We're Kaleidoscope, and we deliver data-driven pressure ulcer prevention. This is Doris. Whilst in hospital for a routine procedure, she's stuck in bed and unable to move as much as she normally would. After a while, she starts to feel an intense pain on her lower back. But now it is too late. A pressure ulcer has started to develop and she's now 5 times more likely to die. Almost all pressure ulcers are preventable, yet due to difficulties in management, they remain a massive global challenge. Pressure ulcers are only detected once visible on the skin, which can be days after they form, delaying early interventions. They are often missed in patients of darker skin tones, leading to a racial disparity in treatment. The prevention strategies are not personalized, resulting in worse outcomes, and recent literature even equating it to elder abuse. Nurses fail to document repositionings, which leaves them liable to litigation. Our groundbreaking solution is a mattress topper that integrates novel sensors and machine learning to reduce the incidence of pressure ulcers. Our unique approach of measuring a key marker of inflammation and connecting it to the onset of the condition makes us the first device to detect pressure ulcers before they're visible in patients of all skin tones. We personalize the prevention strategy so patients are only moved when necessary. We automate the documentation, providing an objective record of patient care, which protects hospitals in litigation and saves nurses time. By reducing the incidence of pressure ulcers, we can significantly shorten hospital stays, avoid unnecessary pain, and most importantly, save lives. Pressure ulcers account for 4% of the total NHS budget, and a massive total of $50 billion is spent globally each year. With growing elderly and bariatric populations, the market is expected to double in the next 10 years. The health economics of pressure ulcer prevention devices are well established. We can save the UK and US $20 billion on treatment costs alone each year, without including the millions saved in litigation. Our initial analysis indicates that we can potentially achieve an ROI of less than a year for hospitals. We will sell directly to hospitals and care home groups and provide servicing of the device. Although we plan to sell globally, we will initially target Massachusetts and Connecticut due to their reimbursement structure and our connections there before we branch out into the NHS. Our device provides unparalleled intelligence without the high price. Most existing competitors use pressure sensors, which do not correspond with the physiological response of the patient. So they cannot detect pressure ulcers early or personalize care and alert nurses about the optimal time to move a patient. They cost tens of thousands of pounds and add additional steps to the nurse's workflow. Our device is significantly cheaper and the only solution to offer all these things. To ensure we are delivering a proven need, we have spoken to over 50 hours of one-on-one nurse interviews across the UK and US over different clinical settings and specialties, enabling early adoption by all. We have worked with NHS procurement to ensure we are creating a financially feasible solution. We have our proof of concept. We have built 2 initial prototypes that can detect the onset of tissue damage and automate the documentation. We've entered into discussions with AHSNs, spoken to experts in trial design, as well as patent lawyers to start the patent process. We have gained further traction as finalists and semi-finalists in various competitions. Nurses are excited about the difference our device will make. 7 lead nurses across the country have already agreed to trial our device once ready. As a team composed of a data scientist from Harvard and a final year medic student from Cardiff, both with engineering degrees from Imperial, we have the right balance of technical and clinical knowledge to help bring this device to market. We receive advice from the experts in this field, including an experienced entrepreneur and part of the world's largest hospital beds company, whose expertise lies in finance and market strategy and bringing medical devices into the NHS. We have Professor Dan Bader, who has decades of experience as the leading scientist in pressure ulcer prevention and device development. We have the head of procurement for pressure ulcer devices for NHS England and the leading clinical advisor in this area. This money will come at a pivotal moment in our development. With the £2,000 won from previous prizes, we have been able to develop our proof of concept. The 10K will crucially allow us to build a full-size device ready for out-of-clinic trials, and then we can then begin our first stage of funding. It will enable us to buy the raw materials, equipment, and to help build this device. Our device will have additional use cases, including for the early detection of pneumonia, sepsis, and sleep monitoring that we are excited to explore in the future. 1 in 10 people in hospital develop a pressure ulcer. One day, someone you love is going to be in Doris's position. With this money, we can help prevent this painful, costly, and preventable condition.